addresses some of that today in different ways Canada is trying to deal with this supply issue again. Here's Justin Trudeau. Let's listen in.
I want to start this morning by recognizing that today is a painful anniversary. It has now been 2 years since the tragic Humboldt Broncos crash. From coast to coast to coast, we remember the 16 lives that ended much too soon and the many more that were changed forever. If you lost a friend, a teammate, or a loved one, if you're still rebuilding and recovering, I want you to know that we're here for you, and we will always be here for you. You, the community of Humboldt, along with all Canadians who stand with you, have shown incredible strength and resilience. And just like the people putting out hockey sticks or wearing the jersey, you remind us that together we can get through even the darkest of times. Right now, as we face a challenge unlike any other, we lean on our friends and family, and we let them know that they can lean on us, too. The weeks and months ahead won't be easy, but we're going to get through this together. I'm sure many of you watched the Queen's address yesterday afternoon, and her message of unity and resolve is more important than ever. No one should feel alone in this. No one should wonder how they'll weather this storm without support. Over the past few weeks, we've brought in a whole range of new measures to help families and workers, seniors and business owners get through this. Taken together, we've introduced the biggest economic measures in our lifetime, which will help millions of people. That includes the Canada Emergency Response Benefit for if you've lost your paycheck. Whether you're taking care of someone who's sick, have been laid off, or are living with a disability, the CERB is there for you. This benefit is now available starting today. If you're born in January, February, or March, you can go to Energeticcity.ca and apply online. If you can't apply online, don't worry. You can call 1-800-959-2041. Since it opened this morning, 240,000 people have already successfully applied. For everyone else, you'll be able to apply another day this week, depending on your birth month. We know you need this support as soon as possible. We have to make sure this system works for everyone. If you're using direct deposit, you'll receive money 3 to 5 days later. The CERB is meant to help all Canadians who need it, and millions of Canadians will be getting it starting this week. But there are some people who don't yet qualify, who we do need to help. If you're working reduced hours, down to 10 hours a week or less, we will soon announce how you will be able to qualify for the CERB. This is to help you if you're a gig worker, a contract worker, or a volunteer firefighter. We'll also have more to say for those who are working, but making less than they would with the benefit. I'm thinking in particular of home care workers or long-term care workers looking after vulnerable seniors. And I know there are also lots of university or college students wondering what kind of job you'll get this summer. You need support now, and work is underway to get it to you as soon as possible. For people in all of these situations, we see you. We're going to be there for you. And we're working as hard as we can to get you the support you need. At the same time, we also announced a new 75% wage subsidy to help you keep your job and help businesses keep their employees on the payroll. Right now, we're drafting legislation and talking to other parties ahead of bringing Parliament back to put the wage subsidy in place as quickly as possible. Supporting you and your family is our top priority. Your Minister of Finance, Bill Morneau, will have more updates soon, but here's the bottom line. Whatever your situation, we are working to get you the help you need. Si vous êtes né en janvier, en février ou en mars,
if you are born in January, February, or March and you've had to stop working because of COVID-19, You can make a request for the Canada Emergency Response Benefit as of today at Canada.ca. Otherwise, you can send a request later on in the week. Many people need help quickly, and we have to make sure that the system is working for everyone. If you opt for direct deposit, it should take 3 to 5 days to receive a first payment. The Canada Emergency Response Benefit seeks to help all Canadians that need help. I know that some people will need help and are not yet eligible. If you have reduced work hours, for example, to 10 hours a week or less, we will announce how you will also be eligible for the Canada Emergency Response Benefit. We will also have news for those who are earning less money now than if they were receiving the benefit, for example, home care workers or those who are taking care of the elderly. There are many university and college students who are wondering what they're going to do this summer. You also need help, and we're working hard to find solutions for you. We're working on a bill, and we're cooperating with the opposition parties to implement the measures that were announced as quickly as possible. Bill Morneau, the Minister of Finance, will provide more details soon. But here is what you need to know. Regardless of your circumstance, we're doing everything in our power to help you. We're working extremely hard to help you and your family so that you're able to manage your finances. Banks have an important role to play because they have the ability to help businesses continue and to help families to pay their bills and their mortgage. I would like to thank the 6 largest banks and some co-ops because they reduced by half the interest rates for credit cards for Canadians having financial difficulties because of the pandemic.
Major banks and of certain credit unions to cut credit card interest rates almost in half for people in financial difficulty because of the pandemic will give them much needed relief on debt. I also want to thank Minister Morneau for his outstanding leadership on this. And we need to see even more action like this going forward because this is a time to think about each other, not about the bottom line. On that note, I want to recognize the new initiative the Canadian Chamber of Commerce launched in partnership with our government. The Canadian Business Resilience Network will help businesses of all sizes get through this tough period, not just get through this tough period, but drive our economic recovery afterwards. This builds on what we've already done to help business owners. We have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. We're here for you. In order to get through this and keep our loved ones and our frontline workers safe, all Canadians need to do their part. Don't forget that you are shaping our future today. What the next weeks and months look like depends on you. It depends on whether you stay home, whether you help protect the vulnerable and make sure our hospitals aren't overwhelmed. Chaque citoyen doit faire sa part.
Everyone has to do their share. Those who have to continue to go to work, nurses, doctors, lab technicians, truck drivers, farmers, everyone is doing their part. They're making sacrifices to allow the rest of the population to stay home. The best way to thank these people is to continue to follow the guidelines of healthcare experts. That is how we can protect our health and their health as well. Thank you.
Monsieur le Premier ministre, on va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Alex Ballingal, Toronto Star. Line is open.
Good morning, Prime Minister. Premier Ford in Ontario reportedly told Sydney News this morning that Ontario could run out of personal protective equipment within a week, and that the U.S. has stopped a shipment of equipment last night. I'm wondering what your reaction to that is. That impending shortage in Ontario? And can you tell us if the U.S. has actually stopped any shipments of goods into Canada?
We are working very closely with all provinces and monitoring the levels of personal protective equipment and the challenges they're facing both on procurement and on making sure that our health officials, healthcare workers across the country get the kind of help that they need. We continue to have productive and positive conversations with the United States, emphasizing for them that healthcare supplies and workers across the border are very much a two-way street, and we need to continue to enable us to be there for our neighbors because it's in our collective interest. Minister Champagne had a good conversation with Secretary Pompeo this morning. Those conversations are continuing, and we expect those supplies to be delivered.
Since the beginning, we've been working with the provincial premiers to make sure that we have sufficient equipment to protect the healthcare workers. We're fully aware of the concerns that people have, that we might run out of PPE during the weeks to come. That's why we're working so hard to source this equipment throughout the world and also to produce domestically. I would like to highlight that we continue to have very productive conversations with the Americans. Minister Champagne had a discussion with Secretary Pompeo this morning, and we expect that these products will be delivered.
Have you, I guess just to repeat that question has there been any shipments that have been stopped that we were expecting to get? And have you received any assurances from the Americans that they will allow these to go through?
As I said, there are very productive conversations ongoing, and we expect those shipments to be delivered.
Thank you. Next question.
Thank you. Merci. Next question, Jim Bronskill, the Canadian Press. Line is open.
Good morning. We're wondering if you can update us on any of the efforts to ensure that people are quarantined who need to be quarantined. Do you have anything to tell us today about whether anyone has been quarantined? And if so, are there any numbers on that score? Thank you.
Anyone returning to Canada is subject to a mandatory quarantine order. That means they have to go straight home from the airport and stay home for 14 days. Public health officials are following up with a number of those people, particularly some of the higher risk or challenging cases. We are confident that Canadians right across the country are obeying the quarantine orders and making sure that they're doing everything they need to do to keep themselves and their loved ones safe.
Follow-up question?
Is there any sense beyond the normal quarantine procedures whether the Quarantine Act has been invoked in special cases and people have actually been forced into quarantine in centers or other locations under the Quarantine Act?
From the very beginning, there was a number of measures that we took on returning flights from Wuhan, for example, on flights coming back from various cruises where we had mandatory quarantines in centers. We have facilities available for people who are returning to Canada and for various reasons cannot quarantine themselves at home or home is too far from the airport. That is why we have institutions in place, and those are being used.
Merci beaucoup. Prochaine question.
Thank you. Merci. Prochaine question, Raymond Filion, TVA, à vous.
Raymond Filion, TVA. Good morning. You said a little bit more than a week ago that you were at the end of your quarantine period. Could you tell us when your quarantine will end and when are you going back to the office? I expect to go back to the office in the days to come. My work will continue to be done from home. This is what we're asking everyone to do. We're asking people to stay home, if possible. And as we've been showing for several weeks now, it's possible to work from home in this situation. Yes, I might have to go to the House of Commons or to the office at some points in the days and the weeks to come, but I will work from home as much as possible. You also mentioned earlier that you spoke about weeks and months to come and that this will be difficult. I understand that the curve depends on people's choices and that data will be published soon. What does this mean, really? What it means is that people have to expect to continue staying at home for several weeks to come and several months to come. We will have more specific answers as we create predictive models that will give us a better idea of what could happen. Each model shows us a lot of variability, and all of this depends on our collective actions, our actions as a society, as individuals, staying at home, and to continue with social distancing is the best way of flattening the curve, but this is going to last several weeks and perhaps several months.
Thank you. Merci. Dernière question, Marie Vastel, Le Devoir, à vous.
Marie Vastel, Le Devoir. Yes, I'd like to come back to the subject of the House of Commons. The session has been suspended for 3 weeks, and the opposition feels that they're being set aside in this democratic process, and you're a minority government. What do you have to say to those who think that you're going around the democratic process and governing alone? No, on the contrary. This is why we are bringing back Parliament to debate on extremely important legislation with regards to helping workers and businesses with the wage subsidy. I'm looking forward to the House of Commons reopening in a reduced capacity to continue doing the important work of parliamentarians. Let us highlight that there are many MPs throughout the country that have been elected to represent their riding, and they cannot come to the House of Commons in this very unique situation. And this is why we're seriously looking at the different ways of having a virtual House of Commons. We know that it's important to allow our democracy to continue working, to give the opportunity to all the MPs and not just those who have the ability or are close to the House of Commons to represent their citizens. And we're going to continue working on this in the days and the weeks to come. Now, on this idea of virtual parliament, what would this look like? You would be present every day? What would this look like? Would you want something more flexible during the crisis? Perhaps you have many things to do. There are a lot of very good ideas as to how we can make our institutions and our processes more robust. I think that is more important than ever to have a strong democracy, to have strong institutions during a crisis. This is why we're working with the other parties and with our institutions and the parliamentary experts to try to find how we can continue to ensure trust and how to ensure that our democracy remains strong even in these very trying times.
Really important that we continue to strengthen our democracy even during a crisis, especially during a crisis. That's why I'm looking forward to seeing Parliament reconvene in a reduced state in the coming days to be able to pass important legislation that's going to get wage subsidies out to employers so people can continue to hold their jobs even in this time where very few people are working. But more than that, we have to look at ways of virtually convening Parliament so that parliamentarians from across the country who were elected to do their jobs of representing their citizens in normal times and in times of crisis can make themselves heard. It can't be just about folks who have proximity to Parliament or the ability to get here. We need to look at ways that our democracy and our institutions can stay strong and and embody and fulfill the functions that Canadians need them to. That's why I'm very much looking forward to discussions with other parties and experts on how we can continue with our institutions even in this difficult time.
Bonjour, Monsieur le Premier ministre. Christian Noël de Radio-Canada. Je n'ai pas changé de nom de famille encore.
Christian Noël, Radio-Canada.
La prestation canadienne universelle pour l'urgence.
Now, if we talk about the Canada Emergency Response Benefit, a lot of people are falling through the cracks and they're wondering how they're going to get by. What changes are you going to bring to this? And when is this going to be available? Will it be retroactive? We're looking at many different profiles of people who are falling between the cracks of the CERB. Some people have seen their work hours reduced significantly, but they're continuing work. And they should have access to this benefit. We're talking about people who are perhaps working 10 hours a week and who are earning $500 a month, and they should have access to the benefit, and we'll see how we can make sure that they can apply, be eligible, and receive the Canadian Emergency Response Benefit. We also recognize that in some settings, for example, nursing homes and others, there are workers who are earning less per month while doing an extremely important work for society, but they're earning less per month than what they would receive if they were not working and were receiving the emergency response benefit. So we want to make sure that these people who are doing this important work are able to continue to do so. And we're looking at different ways how to provide more money so that they can continue doing this essential work. We will have more things to announce in the days to come.
The Canada Emergency Response Benefit is there to help millions of Canadians. We've moved quickly on it to try and help as many people as we possibly can, as quickly as possible, and that's rolling out today. But at the same time, we recognize that there are groups of people who aren't benefiting from the Canada Emergency Response Benefit who probably should. I think specifically of people who've seen their hours reduced massively down to 10 hours a week or less, maybe making a total of $500 a month, who are in a precarious situation, who really would and should benefit from the Canada Emergency Response Benefit. So we're going to be announcing in the coming days how people in that situation will be able to apply and receive the Canada Emergency Response Benefit. Think of other groups of people who, perhaps people working in long-term care facilities or seniors' residences who do extremely important work, particularly these days, but who actually don't make as much per month as they would if they had lost their job and were receiving the response benefit. That's why we're looking carefully at how we can increase their pay a little bit so that they do better off remaining at work rather than receiving, going off work and receiving the emergency response benefit. These are fine-tunings that we knew we would have to do because in any program you're trying to help as many people as possible. There will be exceptions that we have to fill, and we're going to keep working to make sure that we get this right and get everyone the help they need.
For
small and medium-sized businesses now, if we look at economic growth for the second quarter, it's not going to be growth. And so the small and medium-sized businesses are the motors of the economy. This 75% wage subsidy is not sufficient for some businesses. So do you understand how we're going to try to adjust? We're now in a situation where what we have to do to counteract the health crisis is having a negative impact and creating an economic crisis as well. But this is the choice that we must make. We must essentially stop the economy in order to weather through this healthcare crisis as quickly as possible. This will allow us then to allow for an economic recovery afterwards in a few months. Now, to weather these very difficult months, we're providing direct assistance to businesses and to workers so that we're able to go through these difficult months with the wage subsidy, with loans and credit that are accessible for small and medium-sized businesses, with funding for larger businesses as well. We are there to make sure that when the economy recovers after this healthcare crisis, we will be in a healthy economic situation, and our economic activity will recover and will be healthy.
I just want to return to that City News report about the shipment of masks. Did the United States block that shipment of masks to Canada? Are you aware of any other shipments that have been delayed or blocked? And you said that you expect the shipment to arrive. If it doesn't, what are you going to do?
We continue to have constructive and productive conversations with officials in the American administration who understand that essential services and supplies are very much a two-way street between Canada and the United States. We are interconnected and interlinked in so many ways, from primary resources flowing to American companies to make the equipment that is so desperately needed both in North America and around the world, to actual shipments of products that go from Canada to the United States, that go from the United States to Canada. We will continue to work together. We're going to make sure that goods and services that are essential continue to flow, and I expect those shipments to come in soon. Okay. Nous savons que
we know that essential goods and services go through the border, go to and from the border. And so we will do everything that we can do. We are convinced that this equipment will arrive.
The United States is recommending that people wear masks when they go out in public. Canada hasn't gone that far. Why is there a reluctance on Canada's part to make that kind of recommendation, given that some healthcare experts say it's a good idea?
I'm not going to make health recommendations to people. I don't think politicians should be opining on health solutions or fixes. I know that Dr. Tam is going to be sharing new reflections on masks in less than an hour now. And I encourage people to continue to listen to her and to health experts and professionals on how best we can keep ourselves safe, how best we can keep our loved ones safe, how best we can keep our healthcare workers safe at this time.
Brian Mullen, Global News. Prime Minister, some of the countries that have had the most success flattening the curve, such as Germany, attribute that to testing. So why aren't we doing more testing? Is it lack of people to administer the tests, lack of testing kits, or a lack of resources?
Every single day we are doing more tests than the day before. We recognize that large-scale testing is a key element of flattening the curve and dealing with the long-term prognosis of this pandemic. We will need to continue to test more and more to get those answers back quickly and be able to monitor the spread of coronavirus through our population. That's why we're continuing to do more tests. That's why we're creating more test kits. That's why we're continuing to develop new solutions on testing. Testing will be an essential part of how we get through this. We
recognize that testing is essential in order to go through this pandemic. That's why each and every day we are doing more tests. That is why we're obtaining new tests as well, a larger number of tests and tests that provide results more quickly. We know that the way to go through this is a large amount of screening.
We've already had deliveries of testing kits, and we will continue to deliver more and more testing kits from around the world, from companies in Canada that are developing them. We know there's a need for more testing kits, and that's what we're working on.
Prime Minister Kevin Gallagher with CTV National News. We're hearing that healthcare professionals, nurses, doctors are being told by hospitals on border towns, specifically Windsor and Sault Ste. Marie, they have to choose between which institutions they're going to work at. They can't work both in the United States and in Canada. Should Canadian healthcare professionals now have to make that choice to reduce the rate and potential contamination of cross-border work that they might do? Should they choose to either work in Canada or the United States?
Provincial premiers and mayors are making extremely difficult decisions and are choosing to do the right things to both protect their own citizens, their own communities, and continue to help our neighbors. We need to get that balance right, and it is going to require some difficult choices. But we know that an essential part of this path forward is not just keeping Canadians safe, which needs to be our top priority, but also helping the world deal with this global crisis, and that's what everyone's trying to do. We recognize
that the premiers and the mayors throughout the country, more particularly close to the border towns, are facing extremely difficult decisions. Their first responsibility is always to ensure the health and safety of Canadians. At the same time, we recognize that we are facing a global pandemic, and we have to be there to help our neighbors if we can.
Specifically, but I need to move on because there's another answer here that we're looking for. From this report that Premier Ford's talking about with this shipment that was blocked yesterday, are you aware of shipments of personal equipment for protecting medical personnel or any other type of shipment that has been blocked by the United States?
We have recognized over the past weeks a number of situations in which shipments coming from different countries around the world have been delayed, haven't arrived with as many products as we were hoping to see. This continues to be an ongoing problem, but specifically with the United States, we are working with them to ensure that the orders that Canada has placed get delivered. We expect those shipments to come.
We recognize that this is a reality throughout the world. Some shipments contain less equipment than was ordered, or that shipments are delayed. We will continue to make sure that Canada receives all the shipments that are ordered. Thank you.